Member for Abbotsford West.
Mr. Speaker, I think that through this extraordinary time, this pandemic, most people have endured. They have endured without complaint. They haven't been out protesting. They haven't been complaining. They've simply gotten on with their lives as best they can and tried to make the best decisions they can for the safety and well-being of their families. And they've only asked for one thing in return. They've asked for the government to be honest with them. That's what they've asked for in return. But, Mr. Speaker, we know that in key areas the government hasn't been honest with them. It has released false numbers on hospitalization rates. It has forced people to submit FOI requests for basic, accurate information about COVID outbreaks in hospitals. And even then, it chooses, as we've just heard, to withhold that information. Vancouver Coastal Health said there were no records. That's unbelievable. That is simply unbelievable. And Fraser Health, as we've just heard, blanks out 55 of 79 pages because apparently the government determined that disclosure would be harmful to its, quote, financial or economic interests.
That's what it says.
That's what the material says, Mr. Speaker. Can the Premier explain which possible financial or economic interest of the government justifies withholding accurate, vital and relevant information from British Columbians about the COVID pandemic?
Minister of Health.
Thank you very much, Honourable Speaker. The member, the former government House leader will know from his experience that the reason why information in a pandemic, the definition of information, how it's provided, is provided by the public health officer, is for exactly that question and the importance of that question of credibility. It's why we have been so supportive, and I would say overall the opposition has been so supportive of Dr. Bonnie Henry, who is responsible for that. And I just can't let the premise of that question go by. The premise of that question go by when the member says that Dr. Henry and other public health officials are not being honest. Well, I just tell you, I am not in agreement with that.
Members, come to order.
I am not in agreement with that.
Members.
Or anyone else.
Continue.
There's an extraordinary effort to provide information about this pandemic. There's extraordinary effort being made to provide information to everyone about this pandemic. There is, as members will know, on the FOI process, there's a process that people go through independently to determine issues of the applicability and whether information will be provided or not. That's the nature of the Freedom of Information and Privacy Act. But I think members know this, and members of the opposition, I say, although I wasn't going to let that statement go by without responding to it, I think members of the opposition have been exceptionally supportive of Dr. Henry as well. And I would never say otherwise, Honourable Speaker, but I would say this, Honourable Speaker, that I think public health has done an exceptional job in providing information to British Columbians. I support them, I'm responsible for their actions in this House, and I'm proud to support them today.
Member for Abbotsford West on supplemental.
Thanks, Mr. Speaker. As a skilled and experienced parliamentarian, the Minister of Health can try as much as he likes to deflect attention away from the essence of the question. But he hasn't done so, and he hasn't answered the question. He hasn't answered the question about why, when a request for information about the safety of hospitals, a request that shouldn't even require an FOI request. It shouldn't be necessary to double-check numbers provided by the government, but that is necessary because the government has released false numbers in the past. He hasn't answered this question. Why is it that 55 pages are blanked out, and the excuse used is that because it would be harmful to the financial or economic interests of the government. Those are what the documents say, Mr. Speaker. The government, the minister, the premier want British Columbians to trust the government, but unfortunately the government doesn't trust British Columbians, Mr. Speaker. Here's the pattern. Here's the pattern that the minister and the premier don't want to acknowledge. They failed to release a report on COVID-19 in long-term care homes. They failed to provide accurate case counts and hospitalization data at the local level. And they're still failing to provide true hospitalization and ICU numbers, despite promising weeks ago to do so. My question again to the Premier, when will he stop blocking the disclosure of information that British Columbians are entitled to have about the safety of their hospitals, and when will he proactively release the accurate information that British Columbians are entitled to have to assess the safety of their hospitals?
Minister of Health.
Public Health has been providing information through the BC Centre for Disease Control and through the Provincial Health Office from the beginning of this pandemic. And there have been, throughout the pandemic, as is absolutely understandable, requests for more information, and they have consistently met those requests. The number of reports that are made available on a daily and weekly basis is exceptional, beyond anything that's provided, I think, on any other issue in government, because Dr. Henry believes, and because I believe, that people need to know the information about a pandemic that's affecting everyone's lives. And that's what we've been doing from the beginning of the pandemic. They define, and we define information. This is why, when you consistently define hospitalizations, you know that in the first period of the pandemic, the first phase of the pandemic, we topped out at 149 people in hospital and 72 people in critical care. That in the month of April, we hit 183 people in critical care. That's more. That now we're at 151 people in critical care. That's a lot. That we're moving people around the province. We provided details to the opposition and to everyone else about all of that. And we're going to continue to do so. The people leading that effort of getting the information, and this assures public confidence, is the Provincial Health Office and the BC Centre for Disease Control. And that's not a way of dodging the question. I support them, and I'm responsible for their actions in this House, and I'm proud of them. I'm proud of the BC CDC and their courageous 7-day-a-week effort throughout this pandemic, and I'm proud of our Provincial Health Office.